Now we're going to go through the treatment of the shoulder capsule itself. So make sure you watch the advanced palpation of finding that capsule. It's really key because if you can't find it, you can't fix it. Next thing we're going to do is we're going to palpate into the capsule. The capsule is really important for overall function of the shoulder, and it's usually really deep and it's difficult to get to, and a lot of people are too compressive. So what we do is we have the patient lay down on their side, right through here. And then the way I like to palpate the capsule, it's coming a little closer for me, is I'll take this arm right here and let it relax. And then essentially what we want to find is some landmarks in here. So I find things that I know. I know this is the humerus, and then essentially where the capsule lives is right between the posterior delt and where the tricep comes together. Usually what happens when people are trying to treat this capsule is they're too much on the posterior delt or they're too much on the tricep, and that makes a big difference. So you can see I'm sinking in. I know this is bone, tricep, posterior delt. I keep working my way back, until I come into the scapula where everything comes together. And that capsule lives right there. And you can see I can really sink in on it and feel that. If there's tension on that, that's telling us there is some scar tissue in there. So the key here is actually going to be client setup as well. They're going to be down on a table on their side, and you want to have everything lined up nice and good. Shoulders are here, hips are here. You don't want them too far rolled this way, too far that way. You want everything to be nice and parallel. And then come around here for me. And then you'll actually see this other arm here. They're nice and relaxed. You want this to be nice and relaxed because the tighter they are, the less effective you're going to get that treatment. So you've already watched the palpation and you know how to get there. So what I'm going to be doing is I'm going to be holding this arm with this opposite hand. And what I like to do is have a little bit of tension when we open up. And the key, as we talked about, was landmarks. Because essentially where that capsule lives is right between the posterior delt and the tricep. And what happens is people are either on the posterior delt or they're on the tricep and they're not effective. So you're going to landmark, as you found in that palpation, and I'm going to find right where that capsule is. And the capsule lies right there. Now the key with a capsule is it's a ligament, so you actually don't want to back off from some of your depth. So what I do is I start here just like this, and I'm approaching this way with my body. And the first thing you're going to do is you're going to get some depth in, and you're not going to back off, and then you're going to set some tension with your thumb. And the key first is you want to bring this motion back just like this, and I'm going very, very slow. And that's forcing that capsule to go. And the first motion when these shoulders are really bad is you're just going to try to get this motion first. That's the first thing that I'm opening up. Good. So the key, as we said, you want to get full depth and you're not going to back out. This is where it needs to go. So you're in here, you're over top, and sometimes if you're having trouble getting some of that depth, you can lean over with your body. That helps you get in there a little deeper, and then you can set your tension just like that. Bring that back nice and slow. We're not in a rush here. As we bring that back, see how that comes back further? And once you get some of that motion, you can slowly drop it with this other one. And our tension is going to be leaning with that body. And when it's really bad, at the end here, I will lean on that for about 5 or 6 seconds to open that up. But the key is the palpation and finding that in the right type of setup for the client. If you do all those steps right, it's going to be a much more effective treatment. So sometimes when a client has really bad shoulder range and you've already cleaned up infraspinatus, this is going to make the next key to open up. So sometimes you just got to meet them where they're at. Some people might only have range down to here, and you have to start lower and you have to work through that. You want to find the range where it's the most optimal, but don't force it. This is not one that you want to force. So as we said, you find it, you palpate, you got tricep here, you have delt here, humerus, humerus, humerus. Now we're right on that capsule. When you find it, it's going to be tender on those people. So let's say we're going to start it right here, and I'm going to get my depth by leaning in with my body. I'm going to get my depth by leaning in with my body. I'm not going to back out, and then I'm going to set that tension just like that. And the first step is we're going to bring this arm back just like this, and you'll feel that pull right away. We want to get this motion first, then we'll slowly drop it in. We're going to hold that for a 5 to 6 count. You're going to get about 5 to 7 passes on that. So the key here is the body mechanics and making sure that that's held good. You want to have this arm be nice and relaxed. You don't want them to be fighting. So you want to hold underneath the elbow, and then the motion is going to be a step like that and then you're going to lean in as you